one of our most basic human needs: sex. But when coronavirus has made something as simple as a kiss or a hug taboo,
we're so used to interacting with people and having touch. And without that right now, we're really at a loss.
so how can we get the physical intimacy we need? Experts have offered advice from who we should be doing it with to how we should be doing it. For many of us, sex has become a burden. For others, a real problem.
Someone once told me purple means sexually frustrated. Desperate times call for desperate measures, but which measures are the right ones? Here's some advice from my colleague and sexpert Kaz at the 77%, DW's Youth Show for Africa.
Because I could. Traffic is crazy. What is it? What's going on? What's happening? Talk to me. I honestly can't take it anymore. Josh is driving me crazy. Okay, details. What's happening? Well, we've been together for like almost a year now. And everything was going great. But once the lockdown started, things just started to change with him. Especially after he lost his job. Sounds like he's grieving? I don't know. I can't imagine what he's going through is easy. But I see what you're saying. I've tried. I've tried to make him comfortable about the situation. I'm still able to cover the bills, but I just don't get it. He's become so distant. He sits in front of the TV all day. We haven't had sex in months. I just don't know what to do. Have you tried having an open conversation with him? I can barely get him to tell me what he'll have for dinner. You think he wants to talk about this? That's a tough one. But also quite common. I mean, I think Josh might be depressed. Yeah, maybe a form of intervention might help. Get someone professionally, preferably come to you, sit, have a conversation between the two of you, I guess. Like, some men struggle to open up because they think it makes them look weak, and we have the patriarchy to thank for that. Maybe he feels like he can no longer act as the provider, which also traditionally is expected of men. But he needs to learn that he's still valued. Like, give him time, like an opportunity to heal. I think that's the best you can do. But what if nothing changes? Or if he refuses to listen? Then it's on you. You have to decide if it's the kind of environment you want to foster a relationship in. Otherwise, what will happen next time things go tough? You need to take care of your own mental health too. Yeah, I suppose that makes sense. But what about the sex? I'm dying. Pull out your vibrator, sis. It's totally normal to lose your sex drive when you're suffering from depression, believe me. But be patient with him, But in the meantime, you can meet your own needs. Okay, yeah. Okay, that makes sense. Okay. Enough about me. How about you? How are you doing? Oh, I'm getting laid, sis. You're so silly.
Researcher Raquel Peel joins us from my hometown, Brisbane. Raquel, good to see you there. Tell me, is your best sexual partner yourself during these difficult times?
Well, it depends. Are you a single person looking for someone new, or are you already in a relationship?
So if you're single, what do you reckon?
Well, if you're single, then you've really got to consider the safety issue with the pandemic. So I guess for me, it doesn't necessarily mean that you are your best partner. If I want to have sex with someone, I would be wanting to have that conversation about safety. Have they been checked for coronavirus? Would they consider getting checked prior to engaging in sexual activity?
But isn't that something that'll scare people away?
Look, when it comes to love and relationships, anything will scare us away if we are willing to go away. But I think if this is something that you want, I think that conversation is warranted. It's the same conversation around safe sex, wearing condoms. We need to have that conversation.
What about what the Terence Higgins Trust advised in the UK back in August last year? To avoid kissing, wear a face covering and choose positions that aren't face-to-face during sex. That sounds a little complicated.
It really does. And I think the advice that I would give is have a conversation. It's a lot more logical to talk about safety, to be open with your partners around whether you've been tested, around whether you would consider being tested. Those considerations to avoid intimacy, that's just not feasible. It's not something that we can, as human beings, do for too long. We are intrinsically motivated to connect. And I think the better advice is let's connect in a safe manner.
How long is it healthy to abstain from sex?
Look, I don't have that number for you. I would just say, look, again, as humans, we are intrinsically motivated to do it. So being told that we can't do it, I don't think that's the right thing. The right thing would be, how do we do it?
Raquel, what about cyber sex?
Why not? It's intimacy. The key element is intimacy. We can be intimate online. So I think that's a good alternative, especially for couples that have been separated by the pandemic, to keep up the intimacy. I would say online sex, but also conversation. So it's a way to keep connected. And I have actually heard from people who have been kept apart but found other ways to connect, that their relationship actually got better.
How did it get better? Can you give me some examples?
Yeah, it got better because, well, one, they had to be a little bit more creative with how they connected, not necessarily just sex, but also communication. And in that communication, they were able to tell each other what they like and don't like. And sometimes in when we are together in the heat of sex, we might not be able to communicate what we want. But in that online environment, they had that opportunity to communicate and say, well, I like this, I don't like that.
More on couples. Lots of couples are in crisis right now. It's a pressure cooker scenario. How can you save a relationship in times like these?
Yeah, look, couples who are in conflict right now are couples who already had conflict in their relationship. And because of the pandemic, those conflicts sort of came to surface. One thing that I often say is to watch for the ratio of interaction that you have with your partner. So it should be a ratio between 5 to 1. So for every one negative thing or negative interaction that you have with your partner, you need 5 positive interactions. So balance the interactions of your partner. Think about how you communicate with them, meaning that instead of using you statements, so you don't do this or you make me upset about this, use I statements. Talk about yourself and how you feel. Turn things around so you can address conflict.
Raquel, can you just leave us with one more piece of advice that'll get us through this crisis, make us perhaps a little less frustrated?
Yeah, one piece of advice. I think if safety is the thing that it's bothering you, have a conversation with your partner about safety. I often hear people talk to me about how do I be safe? How do I change things? Have a conversation with your partner of what it is to be safe. Change your routine if need be, because if you are going to be locked down, you need to start communicating a lot more.
You heard it from Raquel Peel. Thank you very much for joining us today.
A look at some of the numbers now, and we're around the 2 million mark of officially recorded COVID deaths worldwide. That's according to figures from the Johns Hopkins University. The United States accounts for nearly 1 in 5 deaths globally, as you can see there. It's followed by Brazil, then India, Mexico, and the UK. And looking at the countries with the highest proportion of deaths in a population, San Marino has more than 1,900 deaths per million. Belgium is next, then Slovenia, Italy, and Bosnia and Herzegovina. Time for your questions on the coronavirus. Over to our science correspondent, Derek Williams.
Should pregnant women get these new vaccines?
I've often been asked how dangerous COVID-19 can be for a pregnant woman or her unborn baby. And I've talked about that topic a few times over the last 10 months, but I've never discussed this aspect of it, whether trying to prevent catching the disease could pose a danger. So let's look at what reliable sources are saying about vaccines and pregnancy. I think the most important thing to be aware of is that we just don't have as much information on pregnant women receiving approved COVID-19 vaccines as we do for other groups, because women who knew they were pregnant weren't included in the large-scale trials that led to emergency vaccine approvals. Of course, some women became pregnant in the course of those trials, and I found no reports indicating that they or their unborn baby suffered any ill side effects attributable to a vaccine candidate. But the fact is, we still simply know less about what might happen to a pregnant woman being vaccinated than we do about other groups. So that's quite rightly causing healthcare authorities to adopt a cautious approach. The general consensus among leading organizations, including the WHO and the CDC, is that there's still just not enough evidence to recommend COVID-19 vaccines to pregnant women on a wide scale. But they also make exceptions for women at increased risk of exposure. For example, frontline healthcare workers. Those women may consider being vaccinated after talking to an expert about everything we know so far about COVID-19 and pregnancy. That's because we also know that pregnant women are in more danger of developing severe forms of the disease if they catch it. If women from those high exposure groups choose to be vaccinated and agree to be tracked, their data will flow into further studies, which should in the near future tell us a lot more about any possible dangers. Many experts currently seem optimistic, though, that the benefits of vaccines will outweigh any risks for pregnant women, too. But the jury is still out.